Hello and welcome to Healthy Knees for You. I'm Robin Robertson with Healthy Knees Coach, and today I'm honored to have Dr. Michael Thorpe for an interview to talk about total knee replacement and knowing when the time is right to do so. My interview with Dr. Thorpe went quite long, and so I've split it into 3 parts. And today, part 1 will cover number 1, how do you know when it's time for a total knee replacement? Number 2, how can you postpone a total knee replacement? And number 3, should you wait as long as you can? Now, Dr. Thorpe also wrote the introduction to my book on cycling, Healthy Knee Cycling. And so it really is such a pleasure to get to spend some time with you. And why don't you tell it? Yeah, I know it has been a while, and that's a good thing. Why don't you tell everyone just a little bit about who you are and what you do?
Okay. Well, I was a 3-sport athlete in college at Drake University, a D1 basketball scholarship. And after I finished that, I went to the University of Iowa for medical school, and then to University of Washington for my 5 years of orthopedic surgery training. Right out of residency, I came to Bellingham and practiced here 33 years. I retired in January of 21, and now I'm just a father of 5 and father of 10 grandchildren. So retirement is awesome.
Living the dream.
Yes,
I know. Well, Dr. Thorpe also knows my knees intimately. Of my 12 knee surgeries, he did 10 of them. So we've been through a lot of knee things together. And I know that he is my trusted go-to source for anything surgical about knees. So today we'll talk about that dreaded total knee replacement.
Yes.
And what it really means, and if you know when you're ready. So my first question is, how does someone know if it is time for a total knee replacement?
Well, one of the lines I used when I was practicing was, "You will know." So I know that's fairly vague, but as we discussed earlier today, I am in that position now personally. Both of my knees are bone on bone, and I'm just trying to decide when that's going to fit my schedule and knock me out of fun time in my retirement. But basically, I think most people, one, you have to meet criteria, right? So you have to be healthy, your weight has to be under a BMI of 40, and your x-rays have to be bad enough to qualify, which means nearly bone on bone or bone on bone, in preferably the medial or lateral compartments. That means, I'll bring my little model in here. So this is a right knee, like this. So if this inner side or the outer side are bone on bone or both, you qualify. Most of the time we don't do knee replacements if it's only the patellofemoral joint, the kneecap joint. But sometimes that gets painful enough that people can't function and they choose to go ahead, particularly if they're older, to have a knee replacement. But so it's meet criteria, and then what are your symptoms like? Because I've known a lot of people that have been bone on bone 10 years, or more. My kneecap joints have been bone on bone for probably 15 or 20 years, but with, I can't say adequate weight control, but attempted, but trying to be as light as you can and keep your muscles good and strong, and then avoid activities that are going to aggravate a painful, an arthritic knee.
Right.
Like, don't be a runner anymore. Move to biking like you did.
Yeah.
Swimming, rowing, things like that. So you're not pounding the knee repetitively.
Right. And that does prolong the time before which you may make that choice ultimately. When I was 24, going into my final track season in college, I had my second knee surgery, not by you.
Yeah.
And that's when I got that news that I was bone on bone, and my doctor then said if he didn't know how old I was, he would have thought I was 85 for the amount of arthritis I already had.
Yeah.
So he said if I wanted to walk when I was 30 years old, I needed to stop doing impact sports now. And I wasn't sure I was going to believe him, but then he showed me the video of the inside of my knee, and I could clearly see the arthritic changes. It looked, instead of like a nice smooth surface with cartilage covering, more like somebody had taken a jackhammer to the surface of the bone, and there were craters and pits and bones growing where it shouldn't be, bone spurs. And it was that point at which I did switch to cycling, which I think really saved my knees and helped me keep that range of motion for ultimately more than 30 years before I had my knee replaced. Now, there were other surgeries in there that helped me maintain that. But
Right. And so just leading into that, the other things you can do shy of your knee replacement is things like Tylenol, anti-inflammatory medications, sometimes even narcotics. We like to stay away from that.
Yeah.
And there's other surgeries that may buy you time. I don't know if you want to go into that, but knee arthroscopy sometimes, and osteotomies, which we did on you. If the knee is getting too bowed like that, we can make a cut in the tibia down here and go from this to this, so that the weight is transferred from the bad side to the good side. And in your case, you were like this, and we cut the distal femur here and made you bow-legged. So yeah,
and that bought me many years.
yeah.
So
80% of the time you can get 7 to 10 years out of an osteotomy, and we got a lot more.
We did get more. I had that surgery, the osteotomy, done when I was 34 years old, and then I ultimately had my knee replaced when I was 56. So not bad, 22 years.
That beats all expectations.
Yeah, I know. I was happy with that because the problem was no one would do a knee replacement when I was 34. I think that's changed a little bit. But talk about age and replacement, and should you wait as long as you can, or should you just go ahead and get it done when you qualify?
Yeah, that kind of depends on the person's age. Obviously we don't want to do knee replacements on 34-year-olds. Not that we wouldn't if there was no other good option. But the way I look at it is, if you can get to an age where you have your one and only knee replacement, we all win. Revision knee replacement, where we do it a second time, isn't quite as successful usually as the first time. So a primary first time knee replacement is the goal at an age where it will last your lifetime. And so, sometimes that's not possible. Sometimes you've got a 40-year-old. I've got several people I still see, at the gym and so forth, who are 39, 40. I know they're bone on bone, and I've advised them in all the non-operative care, and they're still suffering. So it's time to go ahead and bite the bullet and do it, because you're weighing, this pain, and you're not having the quality of life versus, yes, I probably will need a revision.